My name is Vishwanand and I'm representing IMC. So IMC is a strategic advisor and insight partner for the 4th edition of Healthcare Summit 2024, which is being held on 14th of December 24 at T-Hub, Gachibowli, Hyderabad. This is our 4th edition. After the success of past 3 editions, we went about looking at a new theme, which is called Hype versus Reality, of delivering new gen technologies, delivering the healthcare solutions. We call this as a sangam of healthcare professional, tech people, advisors, scientists, innovators. So when I say healthcare sangam, is what I mean is that these are the mix of people who come across from the India, and we proudly say that we have more than 75% of our speakers coming from across India to be part of this sangam. We are aiming Healthcare Summit 24 to benchmark and beat Gen AI with respect to knowledge, insights, and original content. We call it Health Futuristic Dialogue, and it follows a thumb rule of 3N, wherein the speakers would be following 3N. The first N stands for what is new. Like when we say new means in current scenario, like our iPhone, EV cars are new. So similarly, speakers would be sharing a specific case studies, impact, and the projects that demonstrate the real world implementation. And followed by this, its second N, what's next. Here, the speakers will be giving you the future outlook. They will discuss about the upcoming trends and the future direction with respect to their field. And finally, it's a third N, that's what is noble. So here, speakers would be sharing the insights on the positive impact, the values, and the societal impact, something that the Google or Chat GPT may not answer. So here we will be expecting speakers to share the descriptive approaches specific to the given topic. The most interesting part of Healthcare Summit 2024 is soon after the on-stage presentation, the speakers would be invited for a boardroom discussion wherein they would take a deep dive into the given topic. Okay, and followed by that, the IMC team would be working towards to develop an integrated learning program for you all, which would be having a mix of the on-stage presentation and the boardroom presentation with certain assessment questions. And once your assessment is done properly, you will be able to get a certificate signed by the respective panel members. So let me take you through how your 6 to 7 hours of the most beautiful part of this year 2025 before we welcome 26 looks to be. It starts with the panel discussion 1, that's the hospital and academics as an innovation hub for new gen technology discovery. The session would be joined by Dr. G V Rao from AIG Hospital, Dr. Uma Nambiar from Indian Institute of Science, Bangalore, Mr. Sirish Arya, and Dr. Rahul Verma would be moderating this particular session. And soon after, followed by this session, we have the most interesting, I would say one of the most interesting, especially for me, and especially when we look at why the majority of the product designs fail. So the session talks about human-centered design, minimizing the product failures in healthcare delivery. We have the best speakers like Dr. Raman Saxena from Indian Institute of Information Technology, Hyderabad. He's also the adjunct professor from IIT Kanpur, Ms. Neha, Dr. Ramesh, and it would be moderated by Mr. Rajesh Raju. Okay. And then it comes the third panel discussion. The topic is the telemedicine and tele-ICU, enhancing the patient outcome through inter-hospital collaboration. So here, it's a pretty interesting session wherein we have Dr. Raghu from Yashoda Hospital, who has been successful of running a cardiac ICU of 100 beds, and by a renowned CIO, Mr. Arvind Shivaraman Krishnan, and Dr. Dilip Raman from Cloud Physician, and it would be moderated by Mr. Capri of AIG Hospital. Okay, so if you look at it, it's a very proper mix of a service provider and a doctor who avails a benefit service, a CIO who implements it. Okay. Then followed by that, the fourth panel discussion is on topic Pharma's role in digital therapeutics, shaping the future of health. Okay, so we have the speakers from Dr. Reddy's and Lupin Digital Health, and followed by this particular session, we have an interesting session called Digital Nursing Revolution, Transforming Patient Care. I urge the entire healthcare fraternity to make sure that please do be very attentive in this session. It's a very hand-picked session called Digital Health Revolution, wherein we all know that the 80% of the healthcare delivery is being responsible by nurses, and how the digital transformation is transforming the nursing care. So we have Dr. Bipin Rathore from NHS, Ms. Kavita, Ms. Sumani, and it would be moderated by Ms. Deepthi. And yes, you have a very decent lunch, and we are sure that that will keep you very energetic, and that energetic that you will be looking forward to something very interesting session, which is called Wellness and Nutraceuticals, Redefining the Modern Healthcare. Okay, so we have our esteemed speaker, Dr. G Bhanuprakash Reddy Garu from NI in Hyderabad. Mr. Sachin Page is flying from Thailand specifically for this particular conference, and especially thank you very much for Dr. V. Mohan. Is just flying for 3 hours to be part of this particular session, and it would be moderated by Mr. Amit Srivastava. Okay, and followed by this particular panel discussion, we have something more interesting, which is the AI in diagnostic, reducing errors and optimizing the workflow. So here we have Mr. Ajit Patil, Dr. Karthik, and Dushyant Jadeja. Not to miss this session, so we have the Googles and the best AI solution which is made in India. The people will be talking here. Then followed by this particular session, we have remote monitoring, transforming health, community health. So we have Mr. Prashant Reddy, who is running successfully an elderly care. Then we have Dr. Shekhar, and with Dr. Satish, who has been successfully running for over a decade ICU department in Apollo Hospital. And it would be moderated by Dr. Sushma from Apollo Telehealth. And there comes I would say the candy of this entire healthcare summit. Why 90% of startup fails? Okay, and I'm sure that majority of you would be coming to especially to understand why 90% of startup fail. So we have a very good speakers coming from who are the health entrepreneurs, like from Mr. Kiran, Mr. Ravi, and Prabdeep, and it would be moderated by Dr. Shravani Reddy. Okay. And finally, we all are very excited. We have a very super business idea. We have a successful business model, and we all look for the venture capital folks to come and fund our project. So we have a session called Venture Capital Role in Shaping Healthcare Future, and it would be the discussion would be having Dr. Vinay, Ms. Karuna, Dr. Hari Prasad Garu, and Dr. Neeta Sachin would be moderating the session. And finally, the session would be ended with AI and branding, adding to value or just it's an imitation. So we have Ms. Ritika, Mr. Richard Payal, and very special guest, the co-founder of NetMeds, Bruce, who specifically coming to speak for this session from Chennai. Okay, and I'm sure that you would be enjoying the discussion here. And the last but not the least, okay, thank you very much for all the folks, all the participants, all the companies who are nominated for award and recognition. So Ms. Soumya would be judging this particular panel, and she would be announcing as top 5 startup who would be invited to come and deliver a short pitch on stage. Okay. So I assure you that the 8 hours on 14 December is going to be rocking. Okay, so the team has worked quite hard and smartly as well for last 3 months, and thank you very much for all the speakers, and very importantly all you guests who are coming. We assure you it would be a paisa vasool session. Thank you very much, and we look forward to welcoming you. Thank you.